conversations like we had today are key as we look back on lessons learned and take past experiences to propel us throughout this pandemic and propel us forward. One example of remarkable collaboration is in this collective fight against COVID-19 is Operation Warp Speed. Thanks to Deputy Secretary Hagan and Surgeon General Adams' incredible efforts to implement the public-private partnership to produce and deliver millions of doses of safe and effective vaccines are underway. In August, UH became the first health system in Northeast Ohio to announce participation in Phase 2-3 global study of Pfizer's investigational vaccine, BNT. To date, UH has enrolled 180 individuals in this clinical trial. And earlier today, we announced UH would also serve as a clinical trial site for AstraZeneca's investigational vaccine. We are pleased to be bringing to this community yet another potential tool in our fight against coronavirus. Since the beginning of this pandemic, UH physicians, scientists, and caregivers have worked tirelessly to secure a range of options for our patients related to testing, treatment, and then prevention of COVID-19. In fact, UH currently has more than 130 interventional and observational clinical studies underway to gain understanding of the pathogenesis of COVID-19, as well as the impact and the outcome of various therapeutic treatment options. With me today to answer and available to answer any questions regarding these issues are Dr. Bob Salata, Physician-in-Chief, Master Clinician in Infectious Diseases, University Hospitals, and the Principal Investigator in the Pfizer clinical trial, and Dr. Grace McComsey, Vice President of Research, Associate Chief Scientific Officer at UH, and the Principal Investigator on the Remdesivir clinical trial, which we completed, and very much now involved in the AstraZeneca clinical trial. We know the COVID-19 pandemic has affected minorities disproportionately, and so UH has been reaching out to communities of color to help educate them on the virus and how to stay safe, encourage participation in clinical trials, enhance access to testing, and hopefully encourage them to access the vaccine once it is available. Recently, UH designated Ohio's first mobile testing center that has been visiting underserved areas across Northeast Ohio. These are just a few of the examples underway and efforts underway to help with this effort. Now, it is my honor to turn this over to United States Health and Human Services Deputy Secretary Eric Hagan. Thank you, Deputy Secretary.
Thank you. Thank you very much, Dr. McGarrian, for that introduction, and really for all the work that you've been doing in Cleveland to keep this community healthy and safe. I want to extend a personal thank you to all the frontline healthcare workers here in Ohio and in Cleveland. Your work throughout this pandemic has been heroic, and your country is grateful to you. The good news is, even as we face concerning trends in case counts across the country, there is light at the end of the tunnel. We can get to a much better place if we focus on the basic hygiene elements that we have been talking about for the past few months. The 3 W's: washing your hands, watching your distance from others, wearing a mask, and avoiding settings where you can't do these things. Some of you may know, and as Dr. McGarrian just talked about, thanks to Operation Warp Speed, which is our historic project to create safe and effective vaccines and therapeutics by the end of the year, we currently have 4 vaccines in Phase 3. That's the last stage of clinical trials. One of those trials has been taking place at University Hospital. One this morning has been announced. So thank you all here for doing the vital work that is necessary for us to make that possible. And also thank you for actively recruiting diverse populations to participate in these trials. Through Operation Warp Speed, we have also made remarkable progress on therapeutics. We now have 2 monoclonal antibody products supported by Operation Warp Speed that have submitted data to the FDA for possible authorization. Substantial amounts of these products have already been produced and continue being produced as we speak, so that they can be distributed to the public when we receive go-ahead from FDA. In addition, on the therapeutics front, National Institutes of Health, which is part of HHS, recently launched a new round of clinical trials on drugs called immune modulators. Recently, as you may have seen, FDA approved the drug Remdesivir, an antiviral, which I know is being studied here and has been administered already to hundreds of thousands of patients this year. Operation Warp Speed supported clinical trials continue for that drug in combination with others that may create an even more effective treatment regimen. We may end up with the so-called cocktail of therapeutics that will enable us to cure or mitigate this disease substantially, even before we have a vaccine available. I also want to underscore that protecting the vulnerable in our society has been at the heart of our response. That's why we announced an unprecedented partnership with CVS and Walgreens to deliver and administer safe and effective COVID-19 vaccines to long-term care facilities across America, including nursing homes and assisted living facilities. And that's where 2.5 million of our fellow citizens live. These people will likely be some of the very first people to be vaccinated, and I'm proud of our collaborative work with the pharmacies in making this happen. On top of that, we announced just last night a comprehensive plan to cover the cost of administering a COVID-19 vaccine, including through Medicare, Medicare Advantage, employer plans, and for the uninsured. So that will allow the administration of this vaccine. The vaccine itself has already been paid for, prepaid for by the government, so when it's available, we will pay for it. So that is taken care of. People will not have to pay for the vaccine. They will not have to pay, and we will now be paying for the administration of the vaccine. We have plans to do so. Finally, I want to know that we've actively been working to combat vaccine hesitancy in this country, both prior to the pandemic and in the midst of it, because a safe and effective vaccine is really only as useful as the number of Americans who take it. With that, I'm happy to turn things over to our Surgeon General, Jerome Adams, who has been such a key voice on getting accurate and vital public health information out there throughout this, and really for addressing vaccine hesitancy over the years. So, Dr. Adams?
Well, good afternoon. I have had a great day here along with Deputy Secretary Hargan. We started off at Mercy Hospital and Health Systems in Canton. We then went to go visit Steris, a facility that is working to ensure that health providers have personal protective equipment readily available. And I want to thank University Hospitals for hosting us for an afternoon conversation where we talked about testing, where we talked about medical education, and where we talked about the need to really move upstream and address transportation, address housing, address the conditions that put people at risk for COVID-19 and disproportionately put minorities at risk for COVID-19. I want to speak directly to the people of Cleveland, and I want to do so by paraphrasing former prisoner of war, Admiral Stockdale. And he said, "We must never, ever lose hope. But we must also always recognize the severity and the reality of the moment. These two things can occur at the same time. We need to recognize that we are in a severe moment. Cases are going up across the country, and they're going up here in Ohio. Positivity is going up, and we're starting to see hospitalizations going up. But we also need to have hope. And the hope comes in knowing that mortality rates are much lower than what they were back in March and in April because of better treatments, better therapeutics, that we're doing a much better job of protecting the vulnerable, those with chronic medical conditions, those who are older, that we've surpassed 140 million tests, and we now have a capability to find the disease where it exists. And you should have hope because we are almost to a vaccine. We have 5 candidates now in phase 3 trials for vaccines. And I just talked with Tony Fauci. We still feel pretty darn good that we will be putting vaccines in arms before the end of 2020. So incredibly important for people to know that we're almost there. But we need you to keep doing your part. More people than ever are wearing masks. More people than ever are practicing good habits when they're out in public. But what we're finding now is that a lot of the spread is occurring in household environments and in interpersonal interactions. Now, instead of staying just within our immediate family group, we're inviting our cousin to come in and join us. We're hanging out with the neighbors. And we know that when bubbles expand too quickly, they pop. And a lot of the spread we're seeing is, again, because too many people are letting their guard down when they're at home, when they're around people who they're comfortable with, without recognizing
that 30, 40, 50% of people out there who are spreading this virus are doing it without ever knowing they even have it. That's what we mean when we say people are asymptomatic. Another reason for you to be hopeful, though, is that we know how to stop this disease in its tracks. New York was the worst place in the world, but they were able to drive their positivity rates down to under 1%. Not with a vaccine, but with what I call the 3 W's. Washing your hands, wearing a mask, and watching your distance. Arizona, if you want a red state, actually was one of the worst in the country earlier this summer. In just a matter of 4 to 6 weeks, they were able to drive their positivity rates down into the green zone by wearing a mask, washing your hands, and watching your distance. So recognize the severity of this moment, the reality of this moment. The fact that 50,000 cases a day will eventually turn into people in hospitals, which will eventually turn into people dying. But also recognize and have hope from the fact that we can stop this from happening. We can turn this virus around in just a matter of 4 to 6 weeks if we all do our part. Wash your hands, wear a mask, and watch your distance. And one more thing that's incredibly important, get your flu shot. This is the most important flu season of our lives. We had 500,000 people hospitalized with the flu last year. We cannot afford to have 500,000 people on top of COVID taking up beds. 39 million people were diagnosed with the flu in the United States last year. We cannot afford to have 39 million people with fevers, with coughs, with runny noses, causing schools to shut down, causing your workplace to shut down, causing you to live in fear and to have to be quarantined because we don't know whether it's flu or whether it's COVID. So go to vaccines.gov. You can put in your address or zip code and find a place near you where you can get your flu shot today. It truly is one of the most important things you can do to protect your community, to help yourself, and to help healthcare workers who are already being stressed out by the increasing cases of COVID-19 that exist out there. We're almost to a vaccine. Have hope. We just need the vigilance to continue just a little bit longer, and we will get there together. Thank you.
You know, what a great thing for Cleveland to have the Surgeon General and the Deputy Secretary here when we are dealing with this. Certainly reassuring to know that all of the work that's being done is getting to a point of potential solutions for the people of Cleveland, the people of this country. So with that being said, I'm happy to open it up for questions from the press.
First question for you, Doctor. Today, there was some thought that maybe Cuyahoga County would reach level purple, and we're seeing all of these cases continuing to rise. What is the message to the public in that? How concerned should we be? Are these should we be a level purple, and how do you conduct your life, knowing that the cases are going up?
Well, I think the beauty of having a level purple, if there is a beauty, is only that I think it will reinforce what our Surgeon General just told us, to remind us that we can eradicate it and get quickly down to a lower level by doing the 3 things that all of us have talked about, which is washing our hands, watching our distance, and wearing a mask. So I think that when we have these sort of outbreaks where we have an uptick in our color of concern, now being purple, I think it is going to force us, hopefully, to remind us of what we need to do. But I think the second thing that we need to remember, as again mentioned by Dr. Adams, is that we have made some tremendous strides since the first waves, if you will, back in March, April. In other words, the amount of folks who clearly we're having uptick in testing, so we're more people testing positive. But there is ultimately a significant improvement in how folks fare who are positive by virtue of the therapeutics that have been developed. One of them was trialed first here in the United States, that being remdesivir, and also some other therapeutics. But also we've learned so much on how to take care of these people. So clearly the hospitalization length, if it happens, is shorter, and the mortality rates have greatly diminished, I think. I think it's a big reminder for us to do what we need to do. Let's listen to the Surgeon General.
Can I take a crack at that too?
Please.
I just want the people of Ohio and of Cleveland in particular to know that it is a false choice to think that you have to choose between health and reopening. The reality is the way that we stay open is by following health measures that will lower disease spread. I'm on the coronavirus task force. We absolutely do not want to shut down the country again, and that is not part of our plan. But we need your help. We need you to understand this here, this mask is an instrument of freedom. This is how we stay open. We need you to understand that some small inconveniences, foregoing that dinner with friends, trying to limit your social gatherings, will allow us to have spring break next year. Will allow your kids to have an in-person graduation. Will allow my 16, 14, and 10-year-olds to go back to school. It is not reopening versus health. Health is the way that we get to reopening. And if we remember that, then I think we will get through this in a better place. We'll get through it more quickly. We'll get through it with fewer lives lost, and we'll actually be able to stay open.
I was going to actually ask about possible shutdowns. The Governor DeWine, twice a week, he employs Ohioans to not gather in groups, not gather for Halloween and those types of things. We have a mask mandate in Ohio, but yet still the numbers are going up. Is it just to continue to hammer that message, or do you see if people don't heed that message? Do you think that shutdowns eventually would be the only thing to bring it down?
Well, that's my concern, is that shutdowns may happen if people don't follow measures, but that is not at all what we're recommending from a federal point of view. What we're trying to do is really, number one, reinforce that more and more people are doing the right things. If you look at the National Geographic study that came out, if you look at the CDC MMWR that came out this week, more and more people are wearing masks. And people need to know that, because they need to understand that doing the right thing actually is lowering spread in the community setting, but people are becoming less vigilant in the household setting. And so we're particularly concerned as we go into the holidays. I want people to understand that traditional trick-or-treating this year is not something that we recommend. If you are going to go trick-or-treating, make sure you stay outside. Make sure you don't have handoffs directly from one person to another. Some things you can do for safer trick-or-treating is to prepare individual bags of candy and leave them outside so that people can pick them up. But we want people to make intelligent choices. When you're thinking about Thanksgiving, I talk about my Surgeon General's prescription. Number one, know your risk. Know whether or not you are at high risk or someone you live with is at high risk for complications from COVID. That means someone who's older, someone who has chronic medical conditions. You can go to cdc.gov and find out the risk factors for COVID. Number two, understand your circumstances. Are you in a county or a place where you've got a lot of spread? And unfortunately, that's a lot of this country. Are you going to a place where you can be outside, because we know outside is better than inside? And then number three, take measures to stay safe. And if you're in a high-risk category or you're going to a high-risk setting, the safest thing to do is probably to stay home. It's not probably, it's definitely to stay home. But if you make a decision to go, then again, try to stay outside, make sure you wear your mask, make sure you're maintaining social distance. We want people to make informed decisions, and we want them to know that this isn't just about your perception of your own personal risk, because a lot of people don't feel like they're at risk for coronavirus, but it's really about helping us stay open. If you want to go to spring break next year, wear a mask. You want to see your kids graduate in person next year, watch your distance. You want to have some semblance of a normal Christmas this year, then again, let's be cautious about those social gatherings. If we make those connections for people, I know that the people of Ohio will do the right thing, because they've pulled together before. This is a community, and we need to think about the things we can do as community members to support one another.
Doctor, you mentioned that you believe a vaccine by the end of the year. Can you elaborate a little bit more on that?
Well, it's important, first of all, to say that the science and the data are going to lead the way. And the companies have independent data and safety monitoring boards who are going to look at safety and efficacy and tell us when we actually can start to produce vaccines. But HHS, the federal government, has really spent an unprecedented amount of time, effort, and money to make sure as soon as a vaccine gets across the finish line and one of these companies applies for authorization, that we can rapidly ramp up doses. And so, for instance, we were in College Station, Texas, just a few weeks ago, the Deputy Secretary and I. There is a 200,000 square foot, $150 million facility that can produce 20 million doses of vaccine per batch. It's ready to go. And so When we look at the trials, actually the companies themselves continue to tell us that they expect they will have safety and efficacy data before the end of this year. And what we can tell you from the federal government is as soon as they tell us that they've got safety and efficacy data, that there's a vaccine that they believe will be beneficial for people, that we are ready instantly to turn on the machinery and ramp it up. And again, talking with Tony Fauci, talking with Deb Birx, talking with all the folks who are part of this process, we really do think there's a good chance that we can start putting vaccinations into people by the end of this year, based on the National Academies of Science and Engineering recommendations. Vulnerable people, people with chronic medical conditions, older people, frontline health workers, and Admiral Giroir has said that if we can vaccinate the right 10 to 20% of people up front, we can get 70 to 80% of the benefit of vaccinations, because that will allow us to protect the people most at risk and to lower our chances of spread.
You mentioned the potential for possibly flattening the curve in the next 4 to 6 weeks if people do things the right way. So should we be buying plane tickets for Thanksgiving, or what is your advice when it comes to air travel? You mentioned being outside and some of the other things, but specific to aviation.
Well, again, I am both optimistic and realistic. I'm optimistic because I know we have the tools to be able to turn this disease around in 4 to 6 weeks. I'm realistic in the fact that I have not seen cases start to go down yet, and we know that cases today will turn into hospitalizations 2, 3, 4 weeks from now. So what I'm asking the people of Ohio to do is to really, really focus on taking the measures that will allow us to bend this curve and start to get cases trending down. And once we see cases start to trend down, then you can say, okay, 3, 4, 5 weeks from that point, we can expect that we are pushing our way back down into the green, and we can have some sense of normalcy. It is possible that we could get this virus under control by Thanksgiving. But as far as likelihood, we'd have to see cases start to trend down first. And I want the people of Cleveland to know they have the ability to make this happen. They just need to have the will to make it happen.
So how hot of a fire would you say, I imagine you all talked about the numbers in Ohio and perhaps Cuyahoga County. How hot of a fire would you say it is right now when it comes to COVID in this?
Well, I think the governor has done a good job. I think the camaraderie that I've seen, which is really unusual among hospital systems that are often competing here in Cleveland, has been great. And that's part of the reason that Ohio overall is still in what we call the green zone as a state. And those are on recent numbers, but they're going in the wrong direction. Green zone meaning positivity rates down around the 5% range. But they're continuing to creep up. They're going in the wrong direction. So right now, the fire isn't as hot as it is across the rest of the country, but we continue to pour kerosene on the fire, and it's going to be blazing soon. And that's why the Deputy Secretary and I are here, because there's still time to put out the fire if people will wear a mask, wash their hands, and watch their distance.
Any other questions? Just let me remind the news folks that we have two of the leaders here. Dr. Slaughter and Dr. McComsey are leading, for the most part, the only vaccine trials here in this region. So if there's any questions about the Pfizer, the AstraZeneca trial, I'm sure they would be happy to answer for you if you have any.
Well, I would love for you to come up just really quickly and tell people why they should feel confident in a vaccine directly from the people who are working on it.
Hi everyone. Let me start first. I think that was nicely said, and it gives such an optimistic but realistic. I love what you said actually, because what I do is, I oversee the clinical research here, and as Dr. Megarian mentioned, we have a lot of trials trying to understand COVID as well as therapeutics and vaccine. And the vaccine is probably the most optimistic and important of these studies, because without it we're never going to go back to a normal state like we got used to, right? We took for granted before. So I would say what we've seen with the reaction of the government to the one incident that happened in the UK, with neurologic adverse events due to one of the vaccines. So what happened is the UK within a week reviewed the study and restarted enrollment. What we saw here, it took an extra months of intense looking at the adverse events to be able to feel comfortable from the FDA, from NIH to say, you know what, we're ready to restart the study. So anybody who think we're cutting corners, I can tell you what I've seen. We've never done as good of a job in terms of safety with the vaccine, as cautious of a job as with the COVID vaccines. So we need people's help. I mean, you're right, we can't do it ourselves. I can do the best study, the best design. If there are no research volunteers that are willing to listen, to volunteer their time, volunteer themselves for a study, we can't do it. So I think the best that we can do is hope that people listen, they're willing to hear what we have to offer with the study, and we're very usually, we tell them everything. So they're gonna hear from us all the potential for any safety concern, you know, efficacy, we're gonna say it as it is, but we would love to have more and more people in the area volunteer for studies because we need them. Otherwise, we just can't do it.
Where can they go for more information about volunteering for a study?
Yeah, I'll be happy. We have established actually a phone line specifically for people to volunteer for clinical trials. We had established a website, which I'm happy to give to you, as well as a URL that they can log on and just volunteer. So usually these days people don't like to talk on the phone, so they can just leave their name, the way they want us to reach them, and we'll reach them right away for any COVID study, including the vaccine studies.
So just a basic questions for someone who might be interested. Would they be getting the coronavirus? What would they be getting and how? Because that might be some concerns for someone who wants to volunteer.
So the way these vaccines are constructed, none of them are live. Although you may have heard about some recent reports that they're going to have a live virus challenge in the UK. Prior to vaccinating them to see how much virus it takes to cause symptoms, but then to look whether or not that protects those that are vaccinated later. We're not doing that here, and that's important to emphasize. So these are placebo-controlled trials, which means that we are blinded, we don't know who's getting what, but half of the individuals get actual vaccine, the other half, in the case of the Pfizer vaccine, get salt water. And we will not unblind those results until we have accumulated sufficient data, and that's analyzed, etc. The primary endpoint to look at efficacy is going to be looking at true blue COVID-19 cases and those that received vaccine versus those that did not. But we have other surrogate markers, including antibody responses, which in the case of both the Moderna vaccine that you've heard about, the AstraZeneca vaccine, and also Pfizer, have been 20 times higher than what we see with natural infection. One of the things we're going to look at, which is also a point of controversy, is how long do those antibody responses last. We are also looking at another arm of immune response called T-cell immunity. We think that may be also important in controlling this virus. We're going to look at that longitudinally as well. But safety is clear. You may know that all the major manufacturers have signed an affidavit saying they will not release their product until they're really certain about both safety and efficacy. And that's another important message to the public. And I have, as Grace has already indicated, I've never seen a vaccine trial or any clinical trial that I've been involved with scrutinized so carefully. It has to be. We are on the phone with Pfizer every single day, in fact sometimes twice daily, and they are analyzing the first 15,000 individuals that have been vaccinated with placebo or not, and that data is being put together now. We're just asked now for the next 15,000, so that's 30,000 individuals. Pfizer, which is unique to the other vaccines right now, is also immunizing children down to the age of 12. And that is important as we want to have widespread distribution of this vaccine at some point. We want to include the children, right? Although they're less at risk, as you know, generally, for severe disease, etc. But they could in turn serve as a means of transmitting this to others that are more vulnerable. The other point that I just wanted to mention on top of what the Surgeon General mentioned is that if you look at how this is changing, that is the pandemic, we're seeing folks about 1.5 to 2 decades younger that are now contracting the virus. Many of them are university-age students who really do not think they're very vulnerable to the complications. In fact, there's a recent story about students in Idaho that purposely tried to become infected so that they could sell their plasma for high amounts of money. But they have to realize, and the learning and educational point here, is that they can certainly develop this. There are some deaths even in those age groups. But more importantly, they can serve as a reservoir for transmitting this to the aged and other vulnerable groups. So we have a lot to do, let alone educating people about the vaccine, its safety and efficacy again. But we're getting there. And I've never seen in my career science move so quickly from the time that this was first really recognized in China to where we're at now, 8-9 months, and to conduct vaccine trials all the way to the last stage in such a relatively condensed period of time is just amazing. And that's why they're vaccinating large numbers of individuals, because we need that safety data and also efficacy data to be really convinced about what's happening.
I think we've got to wrap up, but I just want people to know that if you want more information about vaccine trials or how to sign up for one, you can go to coronavirus.gov. If you want more information about vaccinations in general, frequently asked questions, or you want to find out where you can go to get your flu vaccine or to get caught up on your child's vaccinations, you can go to vaccines.gov. But get your flu shot as soon as you can. This is the most important flu season of our lifetimes, and it's one real and tangible thing that you can do right now to help us in our fight against coronavirus and to keep our communities and our healthcare workers safe.
Well, thank you, everybody. I just want to say, again, thank you to the administration for allowing for these two leaders to come, Secretary Hart, Surgeon General Adams, to come to Cleveland and University Hospitals. You came, I think, because of all the things we're doing, but also we've learned a lot from you today. Thank you very much. Thank you for coming. Is this your phone?
Very nice meeting you.
Surgeon General, is this your
No, that's
phone?
not my phone. No, that's mine.
Oh, okay.
I've seen you on TV.
Thank you.
Oh, you did? I didn't know that.
Ask them about it.
That's great. No, we don't call them that. I saw, we were going to just went
all kinds of different audiences and speaking different ways. It's been, we're dealing with a pleasurable experience to be able to learn from them and to bounce things off.
Yeah, the pandemic brought that band together.